This is Uganda's experience in putting communities at the center to fight Ebola.
This is to notify you about a confirmed Ebola outbreak in Mubende district. One suspected case of viral hemorrhagic fever was identified and isolated in Mubende Regional Referral Hospital.
Sudan, another deadly Ebola virus hitting the country for a record 5th time since 2000. Sudan Ebola virus was highly infectious, spreading very fast from one person to another, hence the rapid response.
We did field assessment to understand the disease, to know what is required, which we did in a considerable time, and then we had to set up a response mechanism.
And it is the community people who alerted us. One of the victims alerted the health workers that people are dying in my community.
Mubende and Kassanda remained Ebola hotspots, but the virus had already spread to the nearby districts of Kagadi, Kyegegwa, Masaka, Jinja, Bunyangabo, Wakiso, and the country's capital city, Kampala. At this point, World Health Organization, which was at the forefront in the fight against Ebola, contacted its UN sister agencies, particularly Unaids, to bank on their capacity and expertise in community engagements.
If we look into Unaids' work, we see that they have a good system in engagement of the community. They have a good system in risk communication. I think these are two major areas of work.
The integration of Ebola in the work that communities were already doing created a unique approach of co-sponsors to UNAIDS system strengthening.
Our main role was actually community mobilization and sensitization, and also the use of our community resource persons to be able to reach out to their peers, to be able to monitor the services in the community, people accessing their services.
During the epidemic, people affected with Ebola were running to traditional healers for health care services. UNAIDS engaged their leaders to create awareness of Ebola prevention amongst their members.
Traditional healers have been an asset of society, not just in Uganda, everywhere. They are an asset to African societies and are trusted by communities. And so they are very important when you're talking about controlling epidemics.
Ebola kyali kintu kizibu nnyo. Okukkiriza nti ddala omuntu tebamuloze.
Twalwawo nnyo n'abantu abalwadde nga tetumanyi bibaluma. Abantu abuntu balowooza ddogo lye liriwo.
Bwe twasaba mu savisi ey'okumakya, kati omwala yalinyibwako ke ebintu ebimu n'ayogera. Ffe ne tulowooza nti mayembe ne tukubira jjajja ffe atuyamba mu mbeera eyo.
Nankubirako waaye nfunye ekizibu kino na kino oba nkomewo eyo ne mugabo olina sayini ziri zitya. Kubanga baatulaga mulimu okuddukana, kusesema, bintu ng'eyo n'okugwebwamu amaanyi.
With over 60,000 members, this group played a neutral role in demystifying Ebola virus myth and misconceptions, and also referring their clients to healthcare centers for treatment.
Wasanga nga mungoli mbutufu musabole taina amuna kitabo kati for example taina amu kitabo nga kati bolaba kino nti awandikamu abalwadde ne waba amazudde nti ayina Ebola oba biki kati engeri gye tuwandika ovuddewa ozotya saawa meka zozze byonna mbiteekamu wano n'enamba y'essimu ne ssente ze mba nkusalidde.
UNAIDS also engaged sex workers, another social group in Kassanda and Mubende district, through their umbrella body, Alliance of Women Advocating for Change. Due to their nature of work, these females interacted with different people on a daily basis, including survivors of Ebola.
What we are doing is sensitizing for them to understand that the clients they're actually going with can be a very big risk for them, and for them to use condoms, especially because Ebola can pass through the semen.
Nakendezaamu k'entambula yange kati basingira ddala otugamba abantu be babuleeta. Kutegeera kati oli nga wankubira esimu n'aŋŋamba nayiseko kitundu gundi wayimiriddemu kasita ŋŋamba nti ye nga mugamba siriiwo.
The partnership was very unique because it also brought Ministry of Health on board. So even though these organizations were working with the communities, they would convene the communities and the Ministry of Health would come and help to train, to deliver messages on what should happen if someone with symptoms, with Ebola symptoms, went to them, or they were asked to transport a sick person, how they could contact the Ministry of Health so that the person can be assisted.
Working with all these groups, the country managed to contain the outbreak in a record time since the first Ebola outbreak in Uganda in 2000.
And take this opportunity to declare that the outbreak is over and Uganda is now free of active Ebola transmission.
Uganda's UNAIDS experience in addressing Ebola posed a critical question among communities infected and affected by HIV and AIDS on the future of UNAIDS beyond 2030.
The future of Unaids will not be that Unaids actually winds up, but we move to a UN entity on community engagement. So that whatever happens, then we have that community. All issues around community would be managed by Unaids.
UNAIDS has a long history and comparative advantage in community engagement. And it is part of its core functions. So we consider that very important. They can do it better, they can do it more efficiently, and there is a lot we will learn from them.
Considering our past experience working with UNAIDS, I think if they re-strategize and position themselves to address issues around pandemic and epidemic management, they will be on top of that game.
At the end of the outbreak, the country recorded a total of 164 confirmed cases, 55 confirmed deaths, and 87 recovered patients. This was partly attributed to the risk communication community engagement pillar, a strong pillar that UNAIDS fully utilized under the meaningful engagement strategy applied through the well-established structures in the affected communities, tailor-made to break future pandemics and epidemics in Uganda and the world at large.